Welcome back to Fox 51 Today. Today we're going to be talking about women's heart health, a very, very important thing to talk about with Dr. Rachel DeVaney with Trinity Mother Francis. Good morning.
Good morning. Thank you for having me.
Well, thank you for stopping by today. We were talking a little bit during the break and you were saying stress can really affect a woman's heart. Now, will you tell us a little bit more about that?
Absolutely. Well, there was a recent study coming out that looked at mental stress and how it affected both men and women. They did a comparison. We know that blood pressure and heart rate can go up with stress, but it seemed to go up more with men, whereas women seem to have more clotting problems in their blood vessels, which increases the risk of both heart attack and stroke.
Now, is there a certain age that this stress really starts to affect a woman's heart, or is it just any age?
I don't know if we have any studies that look at age specifically on stress in their heart health, but any stress is, suboptimal. You really want to minimize any stress you can.
Now, what are some of the problems that this can create for your heart?
Absolutely. Well, like I said, both blood pressure, heart rate can go up, and that's good. That's not good for men or women. But also, they've found that some clotting problems in the vessels can increase that risk of heart attack and stroke, like I mentioned.
Well, that's definitely not good. Now, is there some sort of maybe yearly or annual doctor's appointment that we should make to get our heart checked out, say we reach a certain age or anything like that?
That's a great question. Everybody should have regular follow-up with their physician, and especially if you have high blood pressure or cholesterol, that needs to be screened on a regular basis and also treated if it's not treated. So keep an eye on that for sure.
That's very important.
Are there certain things that we can do even in the present to help us reduce any kind of stress that we have? Sometimes I know we have a lot of load, or it's just a busy lifestyle and whatnot. Are there other things that we can do to help reduce that stress?
Another great question. So exercise is a terrific way of reducing your stress, and you can't always change those stressful things in your life, but hopefully you can change how you respond to them.
So we know that we can maybe respond differently to stress, go exercise. Is there anything else you would recommend for us to really watch out for so that we can reduce the stress?
Yeah, well, for women in particular, it's important to keep an eye on symptoms that aren't classic. A lot of men have those classic chest pain or pressure symptoms that can be a sign of heart attack, and for women it may not be as obvious. So stress may have that type of effect. You need to keep an eye on for nausea and vomiting, sweating, symptoms that aren't really obvious for a heart attack. But if something comes up that's concerning, you need to get it checked out right away.
Okay, so if we've got these symptoms, we really need to go to the doctor. Are there any other, say you're having these symptoms, do sometimes people get it confused with some other disease or illness sometimes?
It happens all the time. And, it's not really obvious what symptoms people have, what the cause is, or what the problem is underlying. So you need really to get evaluated by a physician to help figure what's going on.
Now, Trinity Mother Francis, do you guys have any programs or things that can really rehabilitate these people that do have heart problems?
Absolutely. So not only do we have medications and procedures to open up blood vessels and treat heart disease, we've got great programs for cardiac rehab and treating people afterward, but also preventing and reducing blood pressure, cholesterol, working on quitting tobacco, optimizing your diet, and we have lots of programs. It's really exciting. The Mother Francis Hospital and Lewis and Peaches Owen's Heart Hospital have a Women's with Heart program. They have a website where you can go see and hear these stories of courageous women that have experienced heart disease. And we'd love to get some nominations for the upcoming year. If we can get the nominations in by December and honor those women this coming February.
Well, thank you so much for stopping by this morning.
Thank you for having me.
Coming up next.